I left South Africa in 1966 to specialize in neurosurgery in England. And I worked there, met the Queen, presented to the Queen. And then I saw a lot of tropical diseases in England. And I thought, well, being South African, I better do that. So I did tropical medicine. And then later, when HIV and AIDS was rampant, I went to University College and did a course on the management and treatment of HIV and AIDS. I did a few things. I worked at the Tavistock, which is the counseling area. And I did a master's as a counseling psychologist because I knew that I was going to return to South Africa. But also in England, I was trained on family counseling, couple counseling, children, dealing with children and all that sort of counseling. So that was good for me. I did the master's at Sussex University, which was part of Roehampton University in England. I also had married Reg Longwane, who was a sportsman but an accountant, but he had been training a lot of white youth in South Africa in weightlifting and also in bodybuilding, because he was a champion in that too. And they used to go overseas and compete internationally and win, but because he was Black, he was not allowed to go with them, nor travel with them. And so he formed an organization called SANDROC, South African Non-Racial Sports Thing. And because of that, the South African government didn't like him, and he had to leave the country because he was going to join Mandela at some stage. So I had married him. So in England, there was also that attached to me. And when I went to South Africa to renew my South African passport, South Africa refused me a South African passport. So I know how it feels to feel stateless. I was very angry, obviously, because I thought I was born in South Africa. My great-great-grandfather was the king of the Pondus, and I'm stateless. And I truly understand how people feel when they throw a bomb sometimes on some of the departments that have made them angry. So in England, I was stateless for 5 years, and I couldn't come to South Africa for 5 years. I could go to any part of the world except South Africa. And I had a young child then called Jameson, whom I wanted my parents obviously to spoil and see, but we couldn't come to South Africa. The threat was the fact that I had married this man. I had married Reginald Longwane, who had to leave the country and who actually had gone to Europe and explained in Europe, in various countries, how sportsmen were not getting the opportunities that they should get in South Africa simply because of their color. And of course, he was preaching the expulsion of South Africa in the Olympic Games. So I was, by marrying him, I had identified with him in his thinking, which of course is true to a certain extent. So because I had married him, then South Africa regarded me as an enemy, I suppose. So, but anyway, I got married. I had a child in England, Jameson, and all went well as could be under those circumstances, but coming home was wonderful because I always had wanted to come home. I appreciate what women do for each other because we live in a society where women need to support each other. We deceive ourselves, or perhaps I could say maybe it's true that things have improved for women. They've improved to a certain extent, but they're still being undermined in many ways. So we need to support each other, encourage each other, and make sure that we uplift each other, inspire and uplift. And for me, this is a very important aspect of being a woman in South Africa. And I think also, not just in South Africa, but having traveled in the world, I know that women still struggle, whether it's in Canada or America or in England. So it's been a very mixture of a lot of things in my life that I felt were very important. And I must say, I have used every bit of information, every bit of education that God has given me. And even at 85, I still go to rural areas. I'm in the board member of an organization called 1-to-1 for Children, and we work in rural communities with mothers. We train mothers, mentor mothers, and we have started training men now. They go to places, door-to-door training. So a lot of things that were happening, and also I knew that South Africa needed psychologists, so got some funding, organized a training for doctors and nurses and a lawyer to go to England and train in counseling, because it was really important with things that were happening in South Africa at the time, violence, anger, people fighting and all that. So that was something that was good. And then, of course, come independence in 1994, I then came to South Africa and started that train called the Pillow Paper Healthcare Train, which was a medical train. And we went to rural communities because my interest has always been about rural communities. The train was one way of making sure that the rural communities had healthcare. So we did that, and it continues. And thanks to Transnet, they were able to help with the building of that train.